A bone density test measures mineral levels in your bones to see how strong they are. For 61-year-old Carol Rubicki, the results are troubling.
My bone health isn't the greatest. I'm at a higher risk for fractures.
So should she take medication as a prevention? To decide, her doctor logged onto a computer program called FRAX.
Since having the FRAX, which is a tool to include additional risk factors for fracture, it helps us understand the risk better in terms of determining what treatment to use.
Besides the patient's bone density score, FRAX takes into account age, sex, height, and weight.
Whether you've had a previous fracture as an adult, whether either of your parents fractured a hip, whether you're a smoker,
and whether you have any medical conditions that can compromise bone health.
I think this tool helps identify people a bit more accurately who's at risk. And I think it tends to avoid treating younger women who have little risk of a fracture.
According to the FRAX formula, Carol's risk for a fracture in the next 10 years is 36%.
Above 20% for any fracture, or perhaps 3% at the hip, it's an indication to consider adding pharmacological therapy.
Along with adequate calcium and vitamin D, a healthy diet, and exercise, Carol is now prepared to keep her bones as strong as possible.